Welcome, everybody. This is the Rotary E-Club of Silicon Valley, and every week we bring you stories of people who are making a difference around the world, locally, digitally, globally. And this week we will be speaking with two doctors who are renowned for their work in treating diseases that disproportionately affect the world's poor. They have together been led the team, I believe, that developed the CORBEVAX vaccine, which they will discuss with us today. We are excited about their work, not merely because it is so important for the world as it is at the moment, but also because in so many ways, their lives and work exemplify what it means to put service above self. This is the motto of Rotary International, 1.2 million members around the world in 36,000 clubs, of which the Rotary E-Club of Silicon Valley is the only one you can find by going to http://rotary.cool, so you know. With that, I would like to hand it over to our guests, Dr. Bottazzi, Dr. Hotez. It is such an honor to have you with us, and I hand it over to you for the program.
Well, thank you very much. And it's a pleasure to be with you, with your very innovative Rotary Club. I actually come from a family of Rotarians. I have a couple of uncles that, have traditionally been in the Rotary, both in my Honduras side and my Italian side. So it's really a pleasure, and even more a pleasure to share this podium with my long-lasting partner of more than 20 plus years, Dr. Peter Hotez, which it's just been a ride, to be quite honest, to be developing myself as a professional, but also as a person, alongside someone who, besides being my partner in science, has been my mentor, and I learn every day something new from him, especially moral courage, that I can assure you. So just a little bit to start the conversation. Again, I was born in Italy, but I did grow up in Honduras, and that already, I think, puts me in a position where I have witnessed for much of my life how countries that struggle with poverty, with populations that don't have access to health, access to education, many, of course, other, certainly challenges, how important it is to bring solutions to them that are certainly, trusted, acceptable, but at the same time that they are affordable and that they're reachable to those populations. And so when I studied microbiology, trying to understand again what are all these diseases that afflict these poorest populations, I got a real interest in the business of how do you then find solutions for those microbes. And that's where I combined a little bit this notion of business of science and learning how you can translate a scientific knowledge, a scientific discovery into products that eventually can be made for real. And when I joined and met Peter, which has a very similar mindset as I do, also very passionate about these microbes, very passionate about the poor populations, of how we can come and bring solutions, I think we kind of complemented each other to arrive to a philosophy that we've both shared personally, but that we were also very lucky that our institutions also share. And then we built a team that, they also kind of drank the Kool-Aid, let's say it, and that have been with us also for the last 20 years, for the most part, which is a philosophy that goes like this, a philosophy where we always put in front the end user, meaning the people we want to serve, and then we walk backwards to create an infrastructure that is anchored on very strong, of course, science, but open, transparent, and shareable. And with that, remove any barriers so that our knowledge and the knowledge that we can discover and create can be reproduced, replicated, and at some level implemented in the low middle income country settings. And that is what now, Peter coined this terminology of vaccine diplomacy, and that we really strive in this philosophy and these values. And so I think, that has been a privilege for us to now see how that philosophy now has really disrupted the way vaccine science is done, with our example of CORBEVAX, which I'm sure we can go into it a little bit more in depth, but I'm now going to hand it over to Peter to say his side of the story.
Well, thank you, Maria Elena. As always, that's a brilliant introduction, and it's been my thrill to work with you these last 20 years, and I've learned so much from you. One of the things that we try to do is very much push this concept of science for humanity, science for humanitarian goals. And at some level, all scientists do that, I feel. But in our case, we're really focused on getting an intervention out to people who live in extreme poverty, people who need them. And that sometimes requires innovation, but sometimes it also requires practicality. So one of the things that concerned us about the mRNA and the adenovirus and the particle technology vaccines, and they're really cool vaccines. And look, I took the Pfizer BioNTech vaccine, and I'm grateful for it. But the problem is, as people in Silicon Valley know as well as anyone, when you start with a brand new technology focused entirely on innovation, there's a learning curve before you can go from 0 to the 9 billion doses you need for the world's low and middle income countries. And the failing to vaccinate the world, which gave us, as a consequence, the Delta variant out of India and the Omicron variant out of Southern Africa, now BA.2.12 and soon BA.4, was not having that situational awareness to say, hey, if there's a learning curve, it's going to take a couple of years to make 9 billion doses of mRNA and adenovirus and particle vaccines. Maybe we should think about a technology in addition to that that's also in place in low and middle income countries. And it turns out that countries such as India, Indonesia, Bangladesh, Thailand, Vietnam, Argentina, Brazil, even on the African continent, make their own hepatitis B vaccine. And that's done through a older process. It's known as it's genetic engineering through microbial fermentation in yeast, which was actually first developed in the Bay Area by Rotary and colleagues at UCSF and elsewhere about 30, 40 years ago. But that technology to make the hepatitis B vaccine, which is a vegan process, so ours is the only vegan vaccine, no animal cells, human cells, animal protein, human protein, the least expensive, in our case, 145 rupees a dose, $1.90 a dose, and as effective as mRNA or adenovirus or the others, maybe even more so, that you can plug and play very quickly into low and middle income country vaccine producers. In fact, they banned themselves as the developing country vaccine manufacturers network. That's how they identify themselves. And so he said, look, this is going to be our philosophy for our parasitic disease vaccines, for diseases such as female genital schistosomiasis, which is a scourge of 40 million girls and women living in extreme poverty in Africa. It's what we do for our hookworm vaccine, our Chagas vaccine. That's what we started doing for SARS and MERS vaccines 10 years ago, because we adopted coronavirus vaccines because they were orphaned just like our parasitic disease vaccines for the poor were. And it worked really well. So when we got the COVID-19 sequence, our team got special permission to work in the labs at that time, because you remember a lot of things were shut down, and they worked very hard. We worked day and night and developed a prototype vaccine, and then transferred the technology to India, to Indonesia, where they're making a halal version because it's vegan technology. You can do that. I guess you could say it could be kosher as well, and to Bangladesh and now Botswana. And it's working. And the vaccine now has gone into 35 million adolescents in India. And now they're working with the World Health Organization for global emergency use listing. So it's extremely satisfying to do it. I think the only regret in the sense was we could never attract big scale public funds. So Operation Warp Speed pretty much cut us out because we weren't a pharma company and we weren't doing an innovative technology, quote unquote. And same with other G7 funding. So fortunately, we were able to do this through private philanthropy like the JPB Foundation in New York and various Texas philanthropies, including Tito's Vodka of all organizations. So not that I'm endorsing alcohol consumption in any way, but if you happen to have a cocktail to start off your Memorial Day weekend, and it happens to be a vodka containing cocktail. Make sure it's with Tito's vodka, and we were able to do it. So we didn't raise billions, but we raised a few million, and we were able to get going. Now our only issue is we could go much further and transfer the technologies to other countries as well, but it's, there's limited things we can do with our current level of support. And then the other thing that we're doing that we're very much involved with is countering this very aggressive anti-vaccine movement. So the other hat I wear, I have 4 adult kids, including Rachel, who has autism and intellectual disabilities. And I wrote a book a few years back called Vaccines Did Not Cause Rachel's Autism. And goes into because that's how the anti-vaccine movement really accelerated in the US. And unfortunately, now it's become a full-on political movement, and now linked even to political extremism. So now you have even groups like the Proud Boys and the Oath Keepers marching at anti-vaccine rallies. So it's taken this very dark turn, and there's a lot of anti-Semitism linked to it, and they know I'm Jewish. And so there's that whole component to it. So, and it's more than an academic discussion. So I'm writing a new book now because I like to write books. This one's called, with the working title, Anti-Science Kills, and it reports on the fact that in the last half of 2021, 200,000 unvaccinated Americans needlessly lost their lives because they refused to get vaccinated. They were defiant about getting vaccinated due to this far-right aggression. And so being able to have that frank discussion has been really challenging. Now it's globalized. So it's gone into Canada, it's gone into Western Europe, and now it's spilling into low and middle income countries. So this is going to be, I think, another huge threat that we have to look at in the coming years. And now it's spilling over into other, not only just COVID-19 vaccines, but all childhood vaccinations. And I really worry about the return of things like measles and whooping cough and as a consequence. So maybe we can even touch on that today as well. But thank you for the opportunity for both of us to give opening remarks, and we're in your hands. So thank you.
Well, a wonderful introduction to the topic. There are going to be loads of questions. I already have quite a list in front of me. And for all of our guests and members, we will recognize you as well. Let me first introduce those on the call. So joining us from District 5170 is Dr. Arlene Noodleman, who is a Rotarian here in the Bay Area. From our club, we have our treasurer, Cecilia Babkirk. We have our paella master, Shags Shagrin. We have our secretary and soon-to-be president-elect, Nick Lagarde, and my name is Rushton Hurley. I am the programs chair and the charter president of the Rotary E-Club of Silicon Valley. So I'd like to start with Dr. Noodleman. If you'd like to go ahead and unmute and ask your question, that would be wonderful.
Well, my first question is just it's such a no-brainer to me, and I don't know if you're doing this, if you're partnering at all with Rotary and Rotary International, because as you know, they're the world's leading organization for polio vaccines, and they've, Rotarians and working with WHO, working with UNICEF and other organizations, but they have spearheaded the vaccine effort for excuse me, that was a call coming in, spearheaded them. It's something like 2.5 billion people have been vaccinated through this effort, and I don't know if you've tapped into it, but if you haven't, I am ready and able to help. Have you done that? Have you reached out to them?
Maybe I can start to give you a few things that we have done. So first of all, we definitely had multiple webinars, with multiple clubs, especially those based in Houston and in Texas. We're very close to the Rotary in the Texas Medical Center. And in fact, there's a lot of representation of Indian nationals, within that Rotary Club. And in fact, we put them in contact with the company in India because that club was very interested in supporting the distribution of the vaccine in India, especially in the very remote areas within the country. So that, I think, is something that we're also very proud that they're continuing. We know that we are very close with the foundation and certainly the Rotary International, including the fact that They're having the meeting in Houston this year. So we're
Right.
actually participating, even though we're going to send pre-recorded messages because we won't be in Houston, we're participating in various events that they're having to incentivize, again, ideas of the kinds of things that we could do, because it's not just also the matter of, getting vaccines and distribute them. It's really the role that you all have in supporting countries in country to strengthen the systems by which then, of course, the vaccines are distributed and used. And so in that example, I'm also working very closely with a series of clubs in Italy that they have some linkages with some of the African countries that they really have an aspiration to, as much as possible, to collect funding and support these types of endeavors. So we are very interested. We've always been very, very close to the Rotary clubs in general, and I know it's complicated. It can become a monster like polio, but I think you all are definitely one of the best allies that we have had throughout the years. I don't know if you want to mention anything else, Peter.
Well, just that I was president of the Sabin Vaccine Institute, a nonprofit in Washington, D.C. from 2000 to 2017. We did a lot of work with Rotary and Cerro de Quadros and to help vaccinate the world against polio. That was extremely meaningful for me. And I do think the Rotarians have an important role here. And not only in the CORBEVAX and COVID-19 vaccines, but also combating anti-vaccine aggression, because I do fear that it's infiltrating now. It's contaminating the African continent, it's the Middle East and Southeast Asia. So there are so many roles for the Rotarians, and I became a close personal friend of Heloisa Sabin, Albert Sabin's widow, who developed the oral polio vaccine, of course, and she was such a committed individual to that and passed away a few years ago. But absolutely.
So when you talked about Rotary, you've talked about individual clubs in Texas and such, but are you working directly with Rotary International?
So Peter, I think you had go ahead.
No, I was just going to say, I'm going to be in Houston next week for the RI convention. So I think it sounds like, I just want to make sure, they've got an endowment of, I don't know, what is it, Russian, $2 billion or $3 billion endowment at RI?
I think it's simply a very large endowment.
It's
maybe we can get together while you're in Houston. I'd love that. And we've had some discussions with the leadership in Chicago, and definitely that's the case, but I don't know that it's really gone that next step to make practical things happen. So the dots haven't really been connected at the level that it should. So we would love your advice and help on that.
Thank you.
So I think what I'll do with this lead time is reach out to Illinois, to Schaumburg, and try to see who's going to be there and see what I can do to get a dialogue, because it's just so obvious to me that Rotary could do, Rotary can do a lot to help this effort, a lot more than what you've even described.
Definitely.
So let me work on that. And Russian, you can give me the contact information. I'll get back with both of you.
I've had some conversations with Dr. Anne Marie Kimball, who's at Rotary, and I knew her because before she was with the Gates Foundation, and in the past we had done some things with the Gates Foundation. So she gets it. She understands the importance, but we just haven't quite overcome that the activation energy needed to actually pin this down.
Okay. All right. I'm in. You'll be hearing from me.
That'd be great. Thank you.
That nicely anticipated the next question, actually, from Cecilia, and I'll combine with one of my own related to the idea of collaboration. So that you've done some work with the Gates Foundation makes perfect sense. Bill Gates is a hero for the work he has done to advance discussions around fighting pandemics. And in thinking about the kinds of collaborations that you clearly had in place in order to be able to do what you've done without the kind of government funding that a big pharma might have, right? I'm curious how those connections happened in places like India, where clearly they have the expertise to produce all kinds of important medical material for use around the world. But this wasn't simply a function of you're talking with someone in a Rotary Club. I mean, my guess is that well before COVID, you were in touch with people there in India. Can you speak a little bit about what it meant to develop those kinds of contacts, how you did it, such that you were well positioned to be able to bring CORBEVAX to the world as you have?
So early, Rushton, you asked me how much time do I spend in Houston? And in fact, I actually spend very little time in Houston, and Peter even probably sometimes even lesser. And it's because indeed that's what we've been doing for the last 2 decades, right? It's of course, it's perfectly fine to have Zoom, which now we have been doing for the last 2+ years. But I think there's a value of the interpersonal connections and engaging and just introducing yourself. And there's something that we have a saying with Peter is that, you know, you really have to sit at the table and be in people's face for them to, you know, to know who you are, to learn what you're doing, even if it's not necessarily something that they need you now. The fact that we have, I've toured India a 2-3 times, going to visit all these manufacturers, the same how we do in Brazil, the same how we do in other locations, just telling them, here we are, this is what the type of work we do, keep us in mind, you know, and then when the time was right, we already had those relationships. And it made it, you know, that at least they knew where we were coming from.
And they contacted us because once the ministers of health, the ministers of science in these low and middle income countries realized, hey, these mRNA vaccines are not coming. The adenovirus vaccines are not coming. The particle vaccines that we're hearing, they're not coming. They contacted us. And the fact that we were able to do this without a patent, you know, as I'd like to say, when your house is on fire, you don't call the patent attorney first, you call the fire department. So we wanted to be the fire department, and we started working on that pretty quickly, doing that technology transfer, which meant providing them with the production cell bank and what Maria Elena calls a starter kit to show how you scale it up and make it and purify it. And we would be on the Zooms with them, their scientists at all hours, helping them with the technology transfer and doing that as our own expense, not only transferring this production cell bank and not patenting it, but actively co-developing it with them. So Maria Elena and I have not slept in 3 years because, you know, when it's working with Asia, what that's like, right? You get up, you know, pretty early because of the time difference. And in my case, I was going to bed with Don Lemon at night at 9 and 10 p.m. here in the Texas time. And so talking to him and Lawrence O'Donnell, et cetera. So like I say, I haven't slept in a long time, but it was very meaningful. And I'm glad we were able to make something happen.
But can I actually expand a little bit in the level of then trust that we built, right, throughout the 20 years? Because with all in all, even if we didn't directly work with them, they trusted because they've seen our evolution, and they, of course, you know, they had their own, of course, you know, accomplishments, especially with biological E. But I think the real distinction here is something that I think is not really well said in our story. And it's the fact that if you look at the way vaccines are developed, either as business as usual or even during this pandemic, there's always this implied perception that a discovery has to flow through a big multinational company, a big pharmaceutical company, practically in the high-income country, before any of these developing country producers can get their hands on. And so the example, right, you know, the Oxford gave it to AstraZeneca, then AstraZeneca gave it to Serum Institute in India. You know, so the J&J gave it, you know, passed it on to the developing countries' production. So those developing country manufacturers have always followed. They're never been considered, you know, at par and equal to as a multinational, even though they probably produce many more vaccines in doses and in quantities and in types compared to these big multinationals. And so we broke that paradigm, because this is the first time ever that from a research laboratory in Texas, which is us, we bypassed the multinationals and went straight to the developing country manufacturer. And then they now are first-rate innovators. They took the technology, developed it for them, for their people, with the same philosophy that we had, that it had to be global access, affordable, and that they're now collaborating with others. And this is the first time that they kind of felt that ownership, and they're so proud of it, because it really disrupted the always you have to wait for someone to give you something from the high income country settings, with, of course, who knows how many types of requirements. We basically said, look, as long as you promise us that you keep it in the spirit of global health, you know who we are, we know who you are. Let's just try to move together and figure out how we're going to patch together the money. And we did it. And I think that's something that I think we feel very proud with, Peter, and it's very unique.
Nice.
Yeah, and the way I say it is, it's not that I have an issue with the multinational pharma companies. They do a lot of important things and provide a lot of vaccines for the Gavi Alliance. But the problem is the ecosystem's gone too far tilt, to the point where, the thinking is only the multinationals have the chops to do this, and eventually the crumbs filter down to the low and middle income countries. And we've seen how it didn't work, and we paid the price for that by allowing the Delta and Omicron variants to emerge. So our point is balance the ecosystem to include models such as ours, where we're partnering with the LMIC, low and middle income country vaccine producers, directly. And I think we've provided proof of concept that that's possible. It's hard work, but it's doable. And now I think we have a model for other vaccines, and now we're looking at a universal coronavirus vaccine now as the next phase. And so we've started that partnership as well.
Wonderful. Nick, does that address your question, or would you like to build on?
Well, it leads into my question, which is about how, because one of the things that maybe it's just because my wife and I are think about these risks and everything, and especially with the conversation with Bill Gates earlier, there's always going to be a next disease. How applicable is the technology, and especially now that you've already got the network that you have, how applicable is it to the next thing that comes down the pike?
Well, our thinking is you never know what's going to work and what's not. And so the more shots on goal you have in different technologies, the better. So we also have an mRNA program. We have other technologies as well. I think what's happening now is everybody's sort of rushing into the mRNA basket, like a little kid's soccer game, where the ball goes off in one direction, all the kids run after the ball. And I think that's a mistake, because you don't know. I mean, mRNA may, there are limits, like every vaccine technology, there are advantages and disadvantages. The mRNA may have some issues around longevity of protection, durability of protection. That's why we need all those boosters, which could be, prevented by boosting with something like our vaccine technology. But, I like to tell the story of what Merck and Company did with the Ebola vaccine. They made a terrific Ebola vaccine using this live virus vector called vesicular stomatitis virus, VSV. And back in 2018, 2019, it gave 90% protection against Ebola and stabilized Central Africa. And so at the start of the COVID-19 pandemic, everybody thought this was going to be the one for COVID-19. And it didn't work. When they put the spike protein gene into that vector, it didn't replicate, and there were other issues. And so the point is, you don't know until you know. And so, and that's why it's really important to keep as many technologies in play as possible, or as like we say, as many shots on goal as you can. And I think the world still hasn't learned that lesson. Now they're all rushing to say we've got to transfer, we've got to loosen patent restrictions on mRNA and build up mRNA all over the world. And sure, that's a good thing to do, but it may not work for the next time around. And so maybe ours will, or maybe it will. And so getting people to understand that we need at least 5 or 6 technologies in play at any given time for any new pandemic threat.
Great, thank you.
As the last question for the recording, I'm sure we'll have more questions once we stop the recording. That's one of the perks of joining live as part of the group that gets to talk with all of the wonderful speakers that we find. As a last question, I'd like to speak to the power of bringing two people with very high professional standards who both have a heart for service together to develop something as important as CORBEVAX. So Dr. Bottazzi, Dr. Hotez, I'm sure individually you could have done all kinds of wonderful things on your own, but you were working together. And so can you speak to it might even be part of the system at Baylor College of Medicine that allows you to share ideas in a way that accelerates innovation. Is that something that as you think about the work you've done applies in some way, or are there other conditions that those working to address problems in their communities might consider as they think about ways to rapidly find creative solutions?
So maybe I'll start, and I have to say, in science, there's now more and more the recognition that team science is more powerful. And, in the old maybe model of, the independent investigator with their own little team and just, working at some level, trying to, sustain getting all these NIH grants and whatnot. I think that's slowly, not yet. I think there's still a lot of, the traditional thinking that, to be an investigator, an independent investigator, you have to have your own grants where you are the PI, where you are the first author or the last author, right? And I think for us, that doesn't work, because in real life, when you look at, again, bringing a discovery, something that you create technologically or even, just scientifically, how you go through the continuum of development requires multidisciplines. We now work with economists, with lawyers, with engineers, right? With ethicists, there's so many different disciplines that it's not even necessary to even just stay in the multidisciplinarity of science, like, biochemistry, microbiology, immunology or whatnot. Now, on the personal side and institutionally, I have to say it's not been easy, right? I can also give you a little bit of a women perspective, because I'm fortunate that I work with Peter and that we see each other as equals, and Peter sees me as an equal and I see him as an equal, but sometimes that's not how we are seen.
Actually, I think
right?
you're smarter, so
no, that's not true. I think we're both smart. We're just smart in different ways. but and I speak again as a woman scientist, and in addition, Latin American, right? In a United States environment, it I have to say has not been easy. I have been very lucky because I have been surrounded with supporting, partners and champions that really want to break that paradigm, and with a little bit of learning of also, with Peter, we always speak about transformational and adaptive leadership skills. We try not to be very transactional. We're trying to really be transformative and try to empower. So, we've gone through a little bit of training here and there, and sometimes we even, engage outside people to just, that really have no vested interest in what we do, so that they can give us a little bit of a perspective of how we operate. We had to learn each other, how our personalities are. I think that was one of the best things that we did, right? Peter knows his strengths and his weaknesses. I know my strengths and my weaknesses. And then we try to, ensure we uncover our blind spots, and that together we can then become a stronger. And then we try to replicate that with our teams with a very not, you always have to have some hierarchy, but, we try to make it very, very, matrix oriented, where everybody knows what they're accountable for, but at the same time, they're all dependent on each other to grow, together. So it's a very different paradigm that definitely academia is learning to evolve towards that type of mentality, and we'll see. I think we're in a good moving forward in that respect.
I think the other piece to this is, when the traditional model for how academic institutions work with industry goes like this, whether you're at UCSF or Stanford or the Chan Zuckerberg Initiative, which are, extraordinary organizations. And, we have many friends and colleagues there, and we partner with them. The idea is you make a discovery, and then the licensing office shops it around to a pharma company or biotech to turn it into an invention, whether it's a new medicine or diagnostic or vaccines. The problem with what we were doing is there were no buyers on the other end. There was nobody wanted a hookworm vaccine or a low-cost COVID vaccine. And so we realized that the only way that this was going to happen is to do the early industrial development ourselves. And I think that's what's kind of interesting about our organization. If you come into our labs, it looks like itself like a small mid-sized biotech that's making what my kids used to call guaranteed money losing products. Although I think there is a business model there, we just haven't, we're still trying to develop that. And that's very unusual to have that in an academic health center or at a university. So, so one of the things that we do, for instance, is, our scientists have to publish because they're in academia. So we publish every step of our process. Every step of CORBEVAX is actually, you can go to PubMed, the National Library of Medicine, and download all of our papers. You could actually reproduce it yourself if you wanted to. And that's also very unusual. And we do that because we're a hybrid of biotech, and also our scientists, have to have papers in advance in the academy as well. So there's nothing quite like it that I've seen, but it's working. But there was never a roadmap for it. We kind of had to invent the roadmap as we went along.
All right. Well, what we will do is we will wind down the recording and then talk a little more. But for all of you who have joined us, thank you for being part of it. Thank you for being part of the recording today. Thank you for being someone who took an interest in the recording as it is presented as the weekly program for the Rotary E-Club of Silicon Valley. And we hope that you will let us know that you were here. So a little farther down the webpage, you'll find our attendance form. Just let us know. And if you put your email address in properly, that will generate an email that you can then share with your Rotary Club to make up a miss. And at the bottom of the page, you'll find the Discuss, DISQUS forum, where we share ideas on the kinds of things that we encounter through these programs, through other elements of our meetings, and we welcome your thoughts, including responses to other comments that may have been left. As we like to do, we hand it back to our speakers for a final word. And so alphabetically, Dr. Bottazzi, you come first. I welcome your thoughts to help us finish off.
Well, first to thank you. Thanks for the invitation. We've been really very privileged to be able to know you, know about your club. It's a very, very interesting new dynamic of how the Rotarians interact amongst each other. I think I'm very, very interested in that model and applaud you, because I think you are reaching a lot more people in the way that you do your asynchronous, access to these types of recordings. So I would be more than happy to learn more, and maybe even one of these days join you all. So it's and keep up with all the wonderful work that you all do.
You would find a welcome home in our club, that is for sure. Dr. Hotez, why don't you take us home?
Well, it's been a real honor to be able to speak with you. It's been a long road, but the road still has a lot of just a lot of miles ahead, and a lot of interesting twists and turns. And I look forward to keeping you in touch on our progress and I think we're fellow travelers and kindred spirits in the sense that, the Rotarians recognized years ago that vaccines don't get into arms by accident, right? It takes hard work and smart people to bring it together to eliminate poliomyelitis. And I think it's going to be true for the diseases that our vaccines target as well. So I hope this is the beginning of something larger, because I think there are many opportunities for many more vaccines. And I do worry about the rise of anti-vaccine aggression out there. And I think we shouldn't underestimate this as a threat. When we talk about big global threats like terrorism or nuclear proliferation or cyber attacks, right now, anti-science, anti-vaccine aggressions killing more people globally than all those things combined. 200,000 Americans, for instance, needlessly lost their lives from COVID. And so I look forward to joining you on that fight as well. So thank you again.
Thank you, Dr. Hotez, Dr. Bottazzi, and everyone. We will see you next week.